drugs which are mainly used in treating the diseases affecting cardiovascular system. That is, one is anti-hypertensive drugs, second is anti-anginal drugs, third is drugs for congestive cardiac failure, also known as congestive heart failure, and anti-arrhythmic drugs. So blood pressure, just starting with anti-hypertensive drugs. Blood pressure, as you know, the blood pressure is what we calculate is arterial blood pressure. It is calculated as the cardiac output into total peripheral resistance. So the cardiac output depends upon the heart rate, the force of contraction of the heart, the filling pressure, that is how much blood is being filled into the heart. That depends upon the blood volume. That again depends upon the renal system, and the venous tone or the tone of the veins also depends upon the filling pressure. And the filling pressure in turn will depends upon the force of contraction. As per the Starling's law of heart, how much blood is being filled, that much forcefully the heart will pump the blood. So altogether that will affect the cardiac output, and it is multiplied with the peripheral resistance or total peripheral resistance. So that is offered with the arterioles, not the arteries, arterioles, because the arterioles divides into the small tubes from the arteries, and they offer a resistance to the flow of blood. So that resistance altogether gives a back pressure on the arteries. So the cardiac output, how much of the blood coming into the blood, how much of the blood coming into the artery, plus the resistance offered with by the arterioles will determine the blood pressure. So this is a basic classification of blood pressure. You can read yourself. I hope you know it better. So how can we reduce the arterial blood pressure? So one thing we can do is we can reduce the blood volume, so that we can reduce the venous return and we can reduce the cardiac output. And second, we can reduce the total peripheral resistance or systemic vascular resistance, that the resistance offered by the arterioles, and finally the cardiac output. So how to reduce the blood volume? So we can reduce the blood volume by either by using the diuretics. So diuretics will increase the urine output, so that can finally lead to the decrease in the blood volume. And indirectly we can also use the drugs acting on RAA system, that is renin, angiotensin, aldosterone system. That can also reduce the blood volume by increasing the urine output. To reduce the systemic vascular resistance or TPR, total peripheral resistance, we require the drugs which can dilate the arterioles, arteriolar dilatase, not artery, arteriolar dilatase. So if you dilate the arterioles, the resistance what is offered by the arterioles towards the artery can be reduced. And the cardiac output can be reduced by multiple ways, either by decreasing the blood volume or by dilating the veins. If you dilate the vein, the blood that is coming back to the heart, that is the venous return, can be reduced. Coming to the classification of anti-hypertensive drugs. It's a big classification. So starting with the drugs acting on renin, angiotensin, aldosterone system. I had written NSIP. It is in the green, you can see here. That is meaning not safe in pregnancy. So these drugs should not be used during the hypertension during the pregnancy. So ACE inhibitor, ACE, that is angiotensin converting enzyme. We are studying in physiology. So angiotensin converting enzyme inhibitors. All drug names ends with the pril. You can see that. Easy to remember. Captopril, enalapril, fosinopril, lisinopril, perindopril, ramipril. Angiotensin receptor antagonist. Kindly correct it. Angiotensin receptor antagonist. And here also all the drug names ends with the sartans. You can see that. So that helps you to remember the drug names: losartan, valsartan, telmisartan, candesartan, olmesartan. Renin inhibitor, that is the first enzyme which is involved in the renin-angiotensin-aldosterone system, aliskiren. And finally, aldosterone receptor antagonist, that is eplerenone and spironolactone. Continuing with the classification, sympatholytics. Remember the ANS, adrenergic beta blockers, propranolol, sotalol, timolol, pindrolol. Again, it is called NSIP, that is not safe in pregnancy because they are non-selective adrenergic beta blockers. Beta-1 adrenergic beta-1 selective adrenergic blockers, that is cardioselective beta blockers. They are safe during pregnancy. We are having so many drugs starting with atenolol, highly important drug, very commonly used drug, atenolol or metoprolol, nebivolol, the latest one, bisoprolol, esmolol. Kindly check it out. Adrenergic alpha-1 blockers, already discussed. All ends with sosins. Remember that: prazosin, terazosin, doxazosin, and tremazosin. Here I had avoided the drug name tamsulosin, which was discussed under alpha-1 blocker under ANS, because tamsulosin is not used for treating hypertension. It is very specific for BHP, benign hyperplasia of prostate gland. Adrenergic alpha-2 agonist. So all the other three, the latter three were blockers, but here it is agonist. Remember, alpha-2 receptor is an autoreceptor. If it is stimulated, it will reduce the release of neurotransmitters or reduce the activity of that particular nervous system. So they are also known as central sympatholytic. Highly important drug, clonidine and methyl-dopa, highly safe during pregnancy. And finally, the mixed alpha and beta blocker, carvedilol and labetalol. They are not safe during pregnancy but highly useful in case of hypertensive emergency or severe hypertension. Continuing with the classification, calcium channel blockers, dihydropyridines. I hope you remember two classes: non-dihydropyridines and dihydropyridines. Amlodipine, all ends with dipine. Remember the name: dipine, amlodipine, felodipine, nicardipine, nifedipine, all those. Non-dihydropyridine type, diltiazem and verapamil. Remember, those two drugs are not safe in pregnancy because they can affect the fetal heart rate. Diuretics, none of the diuretics are safe during pregnancy. Thiazide diuretics, that is chlorothiazide and thiazide-like diuretic, indapamide and chlorothalidone. Loop diuretic, furosemide and torsemide. Kindly note down: thiazide diuretic, chlorothiazide and hydrochlorothiazide. That is missing in that classification. Kindly note it down: chlorothiazide and hydrochlorothiazide. You have just put hydro in front of chlorothiazide, you will get the second drug name.